Welcome to the AW3 laser presentation. This course is designed to teach you the theory of laser hair reduction, how it works, who can be treated, contraindications, and aftercare advice. Hair reduction. We will now look at how lasers reduce unwanted hair. The laser light is absorbed by melanin, which is the pigment found within hair and skin. The more pigment present within the hair and skin, the darker it will be. The light is absorbed by the melanin, which converts to heat. The more melanin there is within the skin and hair, the more heat is created. The heat destroys the hair follicle, resulting in its inability to regrow. Caution must always be exercised on darker skin types, as more heat is created, resulting in more pain and risk of burns. Now we will look at a diagram of how the hair removal process works. As you can see, the hair is in the follicle. The hair needs to be there in order for the light to be attracted to the melanin to create the heat. As the light hits the hair follicle, it destroys its ability to regrow, resulting in permanent hair reduction. How many sessions are needed in order to achieve permanent hair reduction? To answer this question, we need to discuss the hair growth cycle. There are 3 stages of hair growth. Firstly, the anagen stage, which is the growing stage, catagen stage, which is the transition stage, and telogen stage, which is where it is resting. When we treat an area, all hair growth stages are targeted. However, only hair in the anagen growth stage can be treated successfully, as this is where the hair is linked to the blood supply and is most likely to be destroyed. The hair can be in any one of these 3 stages at any one time. The number of hairs in the anagen stage at any one time varies from 10 to 70%, depending on the body site. We would therefore recommend 6 sessions every 4 to 8 weeks for best results. What results can the client expect to achieve? With the AW3 laser system, clients can expect to see that the hairs in the treatment area are reduced, become finer, and less pigmented. Now we'll recap on how the hair removal treatment works. The light is attracted to the melanin found in the hair and skin. The light absorbed by the melanin then converts to heat. The heat that hits the base of the hair follicle destroys it. The hair will then become detached from the follicle and will naturally shed out, resulting in its ability to regrow being hindered. All customers wishing to experience the AW3 laser system must, by law, carry out a full patch test and consultation prior to the first treatment. With the AW3 laser system, we can treat skin types 1 to 5 on the Fitzpatrick skin type scale. Typically, a skin type 1 definition would be a person with naturally occurring red to blonde hair, blue to green eyes, and very light skin. Their reaction to overexposure to UV light would be that they would always burn and they do not tan. A typical skin type 2 would have light to medium hair, skin and eyes, and their reaction to overexposure to UV light would be that they would usually burn, but they would self-tan. A skin type 3 would have medium to dark hair, eyes and skin, and also olive skin. These people moderately burn and usually tan. A skin type 4 would have dark hair and eyes, dark olive to light brown skin, and overexposure to UV light would mean that they would burn very mildly and have moderate tanning. A skin type 5 would have dark hair, eyes and skin. They seldom burn and tan deeply. Please note that suntan does not alter the degree of skin type. Suntan only alters the degree of pigmentation in the skin, and skin type is race dependent and does not change, even with a tan. This means a skin type 2 with a deep suntan would not become a skin type 4. We would still program them as a skin type 2, but we would program the amount of suntan that they have on the areas to be treated. Before performing a patch test, we must go through all the contraindications that may prevent us from carrying out any IPL treatments for our clients. Any clients who are suffering from heart disease, or have burns or grafted skin, or liver or kidney disease, cannot receive the treatment. If a customer has birthmarks, for example, port wine stain or hemangioma, they can receive the treatment. However, although we can work around them, we are unable to treat the area of the port wine stain or hemangioma. If a customer has shingles, steroid or hormonal therapy, a thyroid hormone deficiency, diabetes, AIDS, gold injections, hemophilia, anticoagulants, or are pregnant or planning pregnancy, they cannot receive the treatment. Customers who have cancer and are currently receiving radiation or chemotherapy are not able to receive the treatment. If the customer is in remission from cancer, we would need a letter from their GP confirming that it is safe for them to receive the treatment. Any customers who have keloid formations or scars, melanoma or moles, epilepsy, psoriasis, vitiligo, lupus disease, an active tan, for example, any tanning within 30 days, the 30-day rule, pacemaker or clotting disorders will not be able to undergo any of the laser treatments on your system. The following is a list of photosensitive and other medications. If a client is taking any of these medications, we would not be able to carry out treatment. Please always refer to this within your manual and check to make sure the customer is safe and clear. With laser treatments, we have what is known as a 30-day rule. With all treatments on the AW3 laser system, which includes hair reduction, skin rejuvenation, pigmentation, acne, thread veins, and wrinkles, a 30-day no UV exposure rule applies. This means that a customer must not use sunbeds, tanning, or self-tan cream. If the area is to be exposed, even in the winter months, a daily application of sunscreen SPF 30+ must be worn. If this is not followed and we still treat a customer, they can experience burns, blisters, and hyperpigmentation, which can take a minimum of 6 months to resolve. About the treatment. Before we perform any hair removal treatment, we must ensure that the hair is no longer than 1 millimeter in length. If the hairs are too long, they can absorb the energy and prevent all of it reaching the base of the hair follicle. The hair can curl up during the treatment and become attached to the applicator, causing the applicator to become damaged. It can make the treatment more painful for the client and cause a burn on the skin. Does the hair removal treatment hurt? The sensation will vary from area to area. We always start on the least sensitive area first. The sensation will depend on a client's pain threshold. The sensation is described like the flicking of a rubber band. The client should never find the treatment unbearable. When performing the treatment, we need to ensure that we are using the correct energy. If this is the case, we would usually see a red ring appear around each hair follicle. We may also see that the hair becomes loose within the follicle. If incorrect energy settings are used, this could result in excessive pain during the treatment for the client, leave an applicator imprint on the client's skin, or cause a burn. We must always ensure that we use the correct energy settings when treating our client, and the pain threshold should be tolerable. Normal post-procedure reactions after the treatment would be mild redness to the skin, sometimes mild tenderness like sunburn, and follicle swelling. After 4 days, the hairs may look like they are growing, and we can exfoliate the skin to help them shed out. It can take 1 to 3 weeks for the hairs to fully shed out of the skin. Once the hair is fully shed out of the skin, we would wait for the client to have a regrow, which will appear patchy before commencing the client's next session. This is usually about 4 weeks. Adverse post-treatment reactions could be burns, blisters, and hypo or hyperpigmentation. These can be caused by the therapist using too high energy settings, not taking precautions, or the customer having sun exposure pre or post-treatment. When treating male clients, please bear in mind they will need a minimum of 8 sessions. This is due to the body's natural drive to produce hair. Hair can regrow in the future. Pre- and post-treatment care. If the area is exposed, use a daily SPF 30+ sunscreen. Aloe vera can be used directly after the treatment to help cool the area, and if there is excessive heat in the area, a cold compress can be used. Do not pick or scratch the area or use any perfumed products. If a customer would like to apply makeup directly after the treatment, we advise they use only a mineral foundation, no hot baths, saunas or steam rooms to be used after the treatment, and no heat treatments to the area. Health and safety. We will now look at health and safety, which will apply to all treatments on the AW3 laser machine. Suitable eyewear must always be worn by the therapist and client during the treatment. The treatment room must not contain any reflective surfaces, mirrors or windows to be covered. The machine must be put on standby mode between shots if not being used to prevent unauthorized usage. Machine must be switched off when not in use to prevent unauthorized access. CO2 fire extinguishers should be located nearby in case of fire. The emergency switch located on top of the machine to be pressed in the event of an emergency. Treatment room should be locked during treatments and a laser warning sign displayed outside. Health and safety continued. All clients must by law have a patch test and full consultation regardless of which treatment they wish to have. If in doubt regarding the client's medical history, we must not treat. Any doubts, please check with your laser protection advisor to ensure you protect yourself and your client. All clients need to sign an informed consent, and we need to check their health history prior to any treatment. Please ensure the client signs after every treatment, and all settings are documented on the patch testing form. We must never treat over tattoos, birthmarks, moles, or semi-permanent makeup, as this can cause a burn. We must provide aftercare on consultation and after each and every treatment. We hope you have enjoyed this presentation.